Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are super excited to be streaming live from the Team Needham podcast studio. No, we are actually in the Moses Lake Professional podcast studio. So thank you for that. Anyway, we are super excited to have Kristen K on our website today. She is a last-minute fill-in, and she's going to do an awesome job. She cannot be on video today. She's going to be joining us with audio, and we're going to be talking about sexual health. So for those of you that follow Janet and I, Janet and I are experts in hormone replacement, and we help men and women all over the United States balance their hormones and feel optimal. And many times we talk about sex, and we talk about how important sex is to keep us healthy, and healthy people have regular sex. So Kristen is going to help give us some ideas about other things that can help us sexually outside of hormones. So Kristen, welcome to our show.
Hi, thank you for having me. Happy to be here.
So tell us a little bit about your background and how you got here on our podcast.
Sure. So I've been in the sexual health and wellness industry for about 20 years, primarily on the sales and marketing side of the business, leveraging my expertise in digital media marketing to help brands build and develop consumer awareness and in turn get in the hands of consumers. I have been working with Matrix Vibes now for about 2 years. I fell in love with their product before I ever considered even representing them in any capacity. It started with a very fateful meeting of our founder and CEO, Rick Magana, at a conference, and he put one of the male enhancement serums on my hand to prove to me that it would work and that it wasn't snake oil. And I was supremely impressed with the instant results that I had on my hands. And from there, we have been working closely to really educate consumers and understanding what the portfolio of products that Matrix Vibes offers is, what it consists of, and how it can help their sexual health and wellness.
Awesome. So Janet, what questions do you have for Kristen?
Okay, Kristen, since you've been with the company for so long or in this field so long, what brought you to this? Was it just the conference that you were at, or was it other modalities and companies that you were working with?
So I've had experience with several companies in this space, some of which are pharmaceutical grade products, and then some that have, touted themselves as natural solutions for erectile dysfunction or female, dryness, things like that. So this particular introduction to Matrix Vibes was in fact fateful. It was on my birthday, funny enough, and a friend of mine introduced me to Rick, who was exhibiting at a conference that I happened to attend. And I'm someone that prides myself on trying to maintain a very naturally healthy lifestyle and physicality. And so when she introduced me to him and he was, explaining that everything's all natural, all of the active ingredients anyways, and the products are all natural, and we can touch on what I mean by that shortly, it piqued my interest. And when he could show me in front of my eyes that the male enhancement product that we have, or one of the male enhancement products, the topical, which is called Matrix Vibes Male Enhancement Serum, that it actually immediately brought blood flow to my own veins on my hand, I was extremely curious about the product and the product lines. So I'd say I pride myself on ensuring that the companies that I work with are, legitimate, and that they're not peddling products that are either spiked with things that are illegal or definitely need to be prescribed. And Matrix Vibes right now, from what I've seen, is one of the only product lines on the market that is 100% clean.
So is Matrix Vibes homeopathic, or is it more like nutritional supplements?
It's more of a nutritional supplement than a homeopathic medicine, if you will. Matrix Vibes, the product line consists of several products. What we really kicked off with were topical serums that are like spot treatment for the issues you may have. So we have a female product, which is 2 female topical serums. One is for female enhancement and one is for female tightening and rejuvenation. Those both are the active ingredients in those, again, all natural, but the inactive ingredient are FDA approved products. And I have a hard time pronouncing them, but it's the mechanism of which the topical delivery is enhanced. That is that are the FDA approved products, and that is the, oh goodness, off the top of my head I can't remember how to pronounce it, but that it's DMSO.
Mhm.
And I'm going to look it up right now on the thing so I can pronounce it, because it's totally off my radar. But anyways, what was I going to say? Sorry, where was I? I was talking about the female and the topicals, and then we have the male topicals. Same thing. It's spot treatment for erectile dysfunction, and we also have a growth serum that we are introducing to the market officially after we finish up our clinical testing and trials. But those are topicals, and then we have consumables, which are a full slate of gummies for men and for women, which we can discuss one at a time or however you want.
So first of all, let's go into sexual health, and what's the number one complaint that you hear or try to treat with sexual health for men?
For men, it's definitely erectile dysfunction and a lack of ability to maintain an erection.
And what about for women?
For women, it depends on the age, of course, but in like your latter 30s, early 40s and beyond, it's vaginal dryness and discomfort with intercourse, which I believe comes with hormonal changes, relating to menopause and whatnot. That is definitely one of them. And then for those that have had have had vaginal births or such, some women, are in pursuit of tightening the vaginal walls again. So that's another point of interest for women that come to us to seek remedy.
So as far as men for erectile dysfunction, usually it's a vasoconstriction issue,
Mm-hmm.
usually from diabetes, hypertension, decreased metabolic health many times.
Mm-hmm.
So a lot of times, any of the drugs, whether they be prescription or non-prescription, L-arginine's a vasodilator to help get blood flow to that area. The phosphodiesterase inhibitors like Viagra, Cialis, those are also vasodilators to help get blood flow to that area. So is that how your products work? Is vasodilation to increase
Yes.
blood flow to that area?
Yes, for the topicals. And in fact, you mentioned L-arginine. We took L-arginine out of our topicals for both men and women because while it is something that it does work for many, it also can exacerbate other conditions within people, like the herpes virus, things like that. And so we don't have that in ours.
Okay. And what about vaginal dryness for women? What product do you have for that?
So the product we have for that is the Female Enhancement Serum. And in that serum, I'm going to tell you exactly what the xanthine is, one of the main ingredients for the instant arousal for women. That is something that incites wetness and induces wetness in the vulva or anywhere, really. Like, you can take all of our products are also safe to, consume if you happen to lick it or something like that. We would never encourage someone to drink it by any stretch of the imagination, but you can even test it. You salivate if you put it like right at the
Right.
tip of your tongue. So it's the xanthine in there that really enhances the wetness in this product.
Janet, what questions do you have?
So that makes a lot of sense. So, because really for women, sometimes it's just the tissue is not producing enough mucus or mucus,
Mm-hmm.
in that is why it's dry and irritating. So, that is a really good point, because sometimes even some of the products that we have commercially over the counter are just to help with wetness, but it doesn't necessarily stimulate your own. So that I like that thought. That's a good, just commenting on that your own body's producing the wetness that it needs for the activity. That's a really good point.
Mm-hmm. And that's why we're really passionate about our topicals. It's not something that people immediately look to when they're on our website or shopping in the stores that carry our products. They're not thinking topically. A lot of people want to ingest something and think that that will just, because that's what it's easier. It's what they know, but our topicals, both for men and for women, for enhancement, whether for erectile or for the wetness and lubrication and excitement, both of them have been formulated in such a way with all natural ingredients to really, really work. And so we're really excited about that.
And you mentioned topicals. So I'm guessing, I'm just kind of taking the way you're talking about them, you must have other things than just topicals.
I'm sorry, say that again.
Well, I'm guessing from the way you're discussing topicals that you must have other things maybe that you take orally to
Yes,
help for sexual enhancement. Is that true?
that is true.
Okay, tell us about those things.
Sure. So we have several different gummy products. Two of them are the Vitality gummies for men and the Vitality gummies for women. Both are formulated with some similar products, but of course then have their specific products for, the male or female customers. Those are a daily vitamin that have proven over time to really enhance male virility and have shown to just overall not just like enhance the sexual arousal and things like that, but also appearance. It helps your skin, your hair, your nails, your overall energy levels. We're very proud of the daily vitality gummies that we have for men and for women. And then we also have, for somebody that's interested in something that is more commercialized, for example, that you're looking to take something maybe 20 minutes before you're ready to be intimate, we have extreme gummies for male and for women, both formulated differently. The male product has Blue Lotus in it, which is known for being able to incite arousal and other, really good feelings to lower performance anxiety and things like that, that then also help to enhance the activation of the other products in it. And then our female gummies currently do not have Blue Lotus in it, but we are planning on adding that to our new formula.
Awesome. So, Jan and I are pharmacists, and we talk about health and wellness all day long and promote health and wellness. And we're also two pharmacists that don't believe in drugs to treat most long-term disease. And we sell supplements in our pharmacy also, Kristen.
Mm-hmm.
And, one of the things that we preach over and over again is that supplements are not an answer to long-term disease necessarily.
Sure.
And so if somebody does have erectile dysfunction, I'm not asking you specifically, I'm kind of commenting for our listeners and viewers. If somebody does have erectile dysfunction, it could indicate a cardiovascular disease problem because they have vasoconstriction going on. And your penis will actually have problems before your heart will, because the vascularity in your penis is smaller than your heart. I think they're 3 millimeters versus 4 millimeters. So if you have erectile dysfunction, it could be a sign of cardiovascular disease. And if you have hypertension or high blood pressure, definitely it's a sign of cardiovascular disease, and so is diabetes. And really the answer is, I'm not saying supplements shouldn't be used long-term, short-term, or that, testosterone couldn't help in the meantime, or Viagra or Cialis. But ultimately, in order to be a healthy version of yourself, you really need to fix the metabolic disease. So if you're overweight, lose weight. Get your blood pressure under control. And I don't mean get your blood pressure under control with medication, because that's not fixing the problem. That's just treating the symptom. I mean reversing your blood pressure by getting metabolically healthy, exercising, sleeping right, eating right, losing weight. Same thing with type 2 diabetes. If you have type 2 diabetes, you have erectile dysfunction, then reverse your diabetes. And if your doctor says that diabetes is not reversible, type 2, then get a new doctor, because it's definitely reversible. You just need to change your lifestyle. So I just wanted to mention that, Kristen.
Sure.
And Janet wants to say something too.
I want to piggyback on what Shawn's saying, because I totally agree with that statement that it could be underlying disease. And if it is, it could also be some of the treatments that your physician are writing for you. So
Right.
don't forget to ask, are there any medications that you have prescribed to me that could be actually causing this problem, because it could be twofold. It could be the disease state, or it could be also what you were already taking. And so don't forget that those two things could be, one or the other. But the whole point, I think, that I want to piggyback with Shawn is, whether it's men or women, our day-to-day activities and our lifestyle hold more power, I think, than anything else, because that's what really sets us up for wellness, right? So we have to maintain a healthy body the best we can. And if you need help with that, your physician should be helping you, not just prescribing you another drug. So I'm going to say this again. If your physician's a drug dealer, you need somebody who isn't, who's going to help you on that path of wellness.
And some of the drugs that can cause erectile dysfunction are a lot of high blood pressure medications. A lot of antidepressants can cause that, and sexual dysfunction in general. So for women that are having sexual dysfunction, whether it's inability to orgasm or whether it's vaginal dryness, there are some drugs that can cause that. A drug notorious for causing vaginal dryness is birth control pills. So before you reach for something to help the vaginal dryness, if you're on birth control pills, you need to get out the birth control pills. And Jan and I've had podcasts on this subject about how to do that. Birth control pills are one of the most dangerous things that a woman could ever take. It puts you into unnatural menopause early and creates all kinds of problems early and later in life. So, Kristen, as pharmacists, we had to say that.
No, I'm glad that you did. You actually you speak my language. I agree. I'm glad you're bringing this up for your listeners, because it's true.
Well, and the reality of it is healthy people have regular sex. So if you're not able to perform regular sex, there might be a reason why. Your body might be saying, hey, you know what? You're not ready for that.
Right.
So, obviously there could be other reasons too, like we said before, but there's no reason that, we take care of patients that are in their 70s and 80s and have regular sex.
Amazing.
There's no reason. Any doctor that says as you get older, sex is as important, get a new doctor. They're liars, and it would suck to be them, is all I got to say. Seriously, we're created, we are created to have regular sex. Yes.
Well, we've had this conversation in the past, but I don't think it's something that we can be left unsaid in this realm. It's a part of a communication between you and your partner. So if somebody's struggling with something, it is kind of a responsibility on your side to seek answers. And I'm not saying that using, I'm glad we're having this conversation about things that can help boost and help, but we need to solve the underlying problems, because it's going to continue as part of it. So with a female, like Shawn said, it could be the birth control pill, but it could be the lack of. And since we talk about hormones, we do regularly talk about things with our clients that can help enhance as you are being treated too. So these products go hand in hand, but we just don't want people to believe that that is going to solve the problem 100%.
No, but for women's, women, I think you mentioned it, Kristen. You mentioned, I don't know if you said menopause, but depending on their age is what you said. Obviously women that have vaginal dryness in their 50s, they probably lack estrogen, and a little bit of estrogen will help
Or
prevent.
testosterone.
Yeah. And it's not just vaginal dryness. They're going to have problems with urinary tract infections. They're going to have problems with urinary incontinence.
Atrophy.
And your products will help great for the lubrication, but it won't prevent some of the other problems long term.
Right. Like the atrophy of tissue is something that happens to women. And if you don't get a hold of it, it can be really a problem. So, some of these things work in conjunction with each other, is my point.
For sure.
Mm-hmm.
So, Kristen, what else do you have to add to our conversation?
Well, I think that I think it's great that people are having greater discussions around sexual enhancements in general. I think that there was a time, obviously, and actually probably still is a little bit of taboo amongst individuals. I see and have heard of so many people covertly, afraid to talk about it, running into, some of these novelty stores and stuff, buying products that they don't know what's in them.
Right.
And people, it's interesting how people will risk their own health and their own safety just to try and have sex, or have sex in a way that they think that they should. And I think it's great that people like you and others are opening up the discussions. And I think the more that people discuss sexual health and wellness, I think the more people will understand and be safer about their choices and what they're using for their own experiences.
Yeah, that's a really good point. And you're right. I mean, I think, Jan and I have talked to many, especially Jan has talked to women that, the conversation doesn't even come up in their doctor's office.
No.
Because that's how taboo it is. And, it's supposed to be a place where you're really, safe to talk, and it should be. But unfortunately, some doctors don't bring up the question. They don't ask the question specifically. They expect, the man or woman to say something, and men will usually say something. If men are having a problem with erections, they will probably say something. But women won't always say something if they're having a problem sexually.
Yeah, that's true.
Janet, what else do you want to add?
Well, I am excited that there's more companies bringing good products out, because for a long time you just had very, very narrow. And the point about going to, different places for some of these products is, like you said, you don't necessarily know the quality of them. And so that's really important, I think, to me. The quality of what we are bringing forth to our clients is something that's really important to me, because, if they're going to use something long term or need to use something, I want a good product in their hands.
Right.
So, Kristen, as we wind this podcast up, I got a few questions for you, okay?
Sure.
So, what do you have a passion for?
Me personally?
Yep.
Sure.
Yeah, personally, I have a passion for making people happy and making people whole.
That's awesome. So, if anybody has any questions about your products, what's the best place to get a hold of you guys?
Oh, sure. To get a hold of me personally, I'm anyone's welcome to email me, Kristen, Kristen at matrixvibes.com, or they can check out our website, which is currently live, but also being enhanced. But that's where you could find the dearth of information on our products, what's in them, how they work, etc. And then if you're looking to shop, you can check out spencersgifts.com as well. They have a whole slate of all of our products. And just research. We're here, pick our brains, send a message. Happy to discuss how our products may be able to benefit your lifestyle. And yeah.
Awesome. Well, I apologize, Kristen. We spelled your name wrong on the banner. I just realized that when you said that with your email. So I
It's
apologize
okay.
for that.
It's all good. Just make
Yeah.
sure that you got Kristen and not Christine if you're emailing. But yeah.
Right.
Either way,
Exactly.
I'll respond.
All right. Well, thank you so much for being on our show today and opening up the conversation about sexual health. We really appreciate it.
Thank you so much.
And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Thursday to our midweek podcast. We are super excited to have Dr. Mary Bowden on our podcast. Dr. Mary Tally Bowden, if you followed her for years, we've had her on our podcast multiple times. She was just recently interviewed by Tucker Carlson, and she is going to be talking about why. I can't even tell you on here because we're streaming on YouTube right now, but we will not be streaming YouTube with Mary because we know we will get censored, because she's going to be talking about a big subject about COVID, but I'm not going to tell you. But just look her up, Mary Bowden, on Tucker Carlson, and just realize that we're going to be interviewing her Thursday, 8 a.m. to 9 a.m. Pacific Standard Time. So please tune into that. And Kristen, thank you so much for tuning in for helping us realize our goal today, which is to educate and empower individuals to take charge of their own health.
Thank you.
Thank you so much.
Take care. Bye-bye.
Bye-bye.